Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. And indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We also are now podcasting, too. You can catch us on podcasts, both on Apple as well as Google. And if this is the first time you are listening to our show is about how our older adult population can live a healthier, happier life. How they do that? They do that by listening here, not to me, but to these extraordinary guests that I have on the show. So without further ado, let me introduce our guests. I've got two here in the studio. I've got to know them for quite a while. One came in remotely back on March of 21, so it's been almost 3 years since he's been on the show. Without further ado, I'd like to introduce Bill Dombi, the President and CEO of the National Association of Home Care and Hospice. Welcome to the show, Bill.
Well, thank you for the opportunity, Bob. Looking forward to our conversation.
So am I. I'm looking forward to having you on. And just to his right, my left, is Angelo Spinola. He is a shareholder of the law firm Polsinelli. Welcome to the show, Angelo.
Thanks for having me.
It's good to have you both here on the show. And you guys are not unaccustomed to being together and co-presenting, doing webinars and speaking from the podium, talking about everything relating to legislation, employment law, healthcare, home healthcare, hospice, and home care. I think this would be a great time. And Bill, I look to you just so we can kind of tee this up. Can you share a little bit about what the National Association of Home Care and Hospice is, so our listeners know?
Yeah, we're a representative of the industry or the community of providers of healthcare services at home health agencies, home care programs, hospices, and even more. We spend most of our time engaged in advocacy with Congress and federal agencies. We occasionally find our way into federal court when we have to sue the government. So our voice is intended to carry both the voice of the providers of care, but also the consumers of the services, because the philosophy we try to bring is that what is good for patients, what is good for consumers of home care is good for the people who provide care to them.
Nice. So, I mean, you have sued the federal government. I've known you since you've done that. That's a pretty daunting task.
You know, my parents thought I was a troublemaker, and now Congress and, the courts think I'm a troublemaker too, perhaps.
Well, Angelo, if you could tee up a little bit about your background, and you are over at Polsinelli as a shareholder, but your specialty is employment law, correct?
That's right, yes.
Tell us a little bit about your background.
Sure. So I actually was a caregiver, provided home care when I was in college, and now that's what I do for a profession. As a lawyer, I learned I was a much better attorney in the background helping than I was a caregiver. So I started doing that as a career. I actually handled one of the cases with Bill. He hired my predecessor firm to sue the government, so that was a lot of fun. And our firm is a platform for home care agencies. We work with agencies across the gambit in every area of law.
Nice. Well, certainly, when you look at what we're doing, and Bill, I don't want to put you on the spot, but you've been doing this for a little while. And, I'm going to guess little more than 30 years, not quite 40?
Oh, well more than 40. No, I began my career during law school, actually. And first client I had as a home care patient was in 1976. So you do the math, and that'll recognize that I'm on a Medicare program myself as a beneficiary.
The United States bicentenary. I remember that.
It was a good year. It was a good year.
It was definitely a good year. And, you know, I put you on the spot only to really talk about how healthcare has really changed. And, you know, you've seen the evolution of not only just, you know, the care delivery, but the needs of so many of Americans and what we're faced with right now.
Care in the home right now is actually the number one care setting that exists for healthcare services, not just for the elderly and the disabled, but for people at large, growing even further into the young and middle-aged individuals. When people think of home care, they probably have a definition that fits exactly what their own personal experience was. Angelo referenced that he was a caregiver. I've had multiple family members receiving a wide variety of healthcare services at home. If I weren't in the profession, I wouldn't know how wide it is, how deep it is in terms of the nature of care. There are things that still can't be done at home, but there are so much that's happening. Hospital level of care at home, you know, end of life care, pediatric services for children who were born with you know, some complications. It's an amazing service from a clinical perspective. The best thing that I've ever done was not to engage in the clinical side of it, because I don't think I could have been of any real help. But I try to do what we can, you know, relative to the government programs that are involved or setting standards and things of that nature. But it is an amazing experience to be involved in healthcare services at home. We're dealing with many vulnerable patients. And so when you wake up in the morning, as we did here, here in Arizona just today, you know, your first thoughts probably go to something positive about what you may have done. And Bob, I know you, you know, as a caregiver, as a caregiving organization that you run, probably have woken up many mornings thinking of some of your patients and how much benefit you've brought to them.
No doubt, no doubt. You know, one of the things that you did say, and you certainly have a leg up on most people, especially since you've been doing this for a little while, is the awareness factor. And, you know, when you even go back to the 70s and you look at even today in 2024, we still, you know, suffer from the fact that people don't really realize they can get care in the home. You know, they think of it as a facility or a setting like that.
Well, and one of the most, I think, incredibly important parts of care at the home is the role family members play. You know, that there are 50 million caregivers that come from family and friends to care for their loved ones in the home. And the constituency that I have supplements them more often than not. An essential supplementation, but it's a team effort there. And so what really happens is the family caregivers add another family member. That's the people from the home care provider.
No, and I'm so glad you brought that up. I mean, that's the real foundation of caregiving is those family members. We have over 50 million that are doing the difficult work and the challenging work of helping their loved ones through this journey of called aging or whatever disease process they're going through. And, you know, certainly the awareness factor, so many of them don't realize the stresses that come along with that, emotional stresses, physical stresses, and they don't really realize that there are outlets out there. And, you know, for me, Bill, I feel like I'm educating every single day. You know, I still think we have such an awareness issue that people don't realize that they can get help at home. They can get resources. They can get the tools to be better caregivers for their loved ones.
We do need to deal with the complexity of that system, though. It is difficult for the people who are not at my level of engagement to navigate that system. Recently had a meeting over in the West Wing at the White House with the Deputy Chief of Staff to the President, whose mother had just entered into home care services, and he was saying, boy, this is so difficult to understand. And he, his other family members, highly educated, you know, feel comfortable, but took them a while to get there. So I think one of the things we would like to continue to work on is to make it a little easier to understand so that people, when they engage in bringing care into their loved ones, don't have to have, you know, the anxiety that just those complexities may bring.
Right, right. And the, you know, complexities come with emotional complexities, but also the financial piece. And And I think that's one of the biggest challenges that we have in home care, especially the work that we do in home supportive care services, is that people haven't really prepared for long-term care. There are 3 or 4 different payer sources that we deal with in the in-home supportive care services, and that's family pay or private pay, long-term care insurance, VA benefits, and Medicaid. And, the government's not there to help you. What did Ronald Reagan say? What are the 6 most feared words? The government's here to help. Medicare doesn't pay for in-home supportive care services, and we've got a lot of work to do to really educate our consumers and the Americans about that. You're listening to Health Futures Taking Stock in You. Hear the music in the background. I'm really pleased to have both Angelo Spinola and Bill Dombi here in the studio with me. Stick around. We got 3 more segments. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. If you're just tuning in, we're in our second segment. I've got Bill Dombi, President and CEO of the National Association of Home Care and Hospice, and I've got Angelo Spinola, shareholder, attorney at law over at Pulcinelli. And, Bill gave us a little bit of background on what NAC is doing and his work at NAC. I talked about him being a caregiver, and when we left off in the end of the first segment, we talked about just the complexities of care in the home, both emotionally and physically, and certainly I left off with the financial piece. And I know that I made the knock against the government, but I mean we have to figure out ways to pay for the services. It is literally a perfect storm that's happening. When we look at the 80-year-old population between now and 2040, more than tripling, and we know that 10,000 people are turning 65 and older every day. We know that 70% of those people that are 65 and older are going to need long-term care. Bill, how am I doing on stats? That's pretty good.
Your stats are good,
Yeah, but it is depressing, right?
I was one of those who turned 65 a bit ago, and so I know I have a lot of fellow baby boomers who are looking forward to what retirement might look like. But as you say, they have to plan for the unexpected in life when care becomes part of that.
Right, and the thing I love about the work that you do at NAC, and certainly with the assistance of people like Angelo over at Pulcinelli, is really helping with the legislative efforts and trying to help the government understand we need more, not less, right? And every single year it feels like you guys are always at a battle when it comes to CMS and reimbursements. They want to cut it, not add to it. And let's face it, I mean, everybody wants to be able to stay at home. Home is the most desired place, and if CMS could really understand too, it's the least expensive place too to be.
Significantly so. An average day stay in home care is $61, and that's in the context of people not necessarily getting care every day, but an average day stay in a hospital is $3,000. And so we're really seeing highly acute patients being cared for at home, not only effectively from a quality of care clinical perspective, but economically, the Medicare program's home health benefit saves Medicare billions of dollars every year. Medicaid, which is the primary long-term care home care program, has proven to save states and federal government under Medicaid hundreds of billions of dollars over the years. But it still stresses. It's still lots of money that's there, and when you have money at issue in a government-run program, you're not going to have a smooth path.
No doubt, no doubt. This guy here to your right, my left, I know that Pulcinelli is and Angelo have been very, how should I say, in a partnership and assistance in terms of helping out, not so much with the CMS legislation, but a lot of the employment stuff that happens. And all of us are struggling. Whether you are in healthcare, whether you're at a retail establishment or food service establishment, we're all challenged with health, with employees. Angela, talk to us a little bit about some of the work that you're doing at Pulcinelli and really helping us in home care and home health and hospice and the work that you're doing.
Sure. Yeah, we really try to help the businesses like yours stay compliant, right, and stay in business. And it's challenging. It's a challenging business to be in. There's so much regulation, so much change. Like you mentioned, you have different reimbursement rates that continue to seem to go down when the cost of labor continues to go up. We have a caregiver shortage problem. So there's a lot in the industry, a lot of legal issues, to try to help navigate these agencies and really, deliver the quality service that you are trying to do, right? And that all the consumers want to have, right? We want to be in the home, we want to age in the home. I think that in today's world, unlike maybe in the past, there's an understanding of how valuable that is now. So we just need to, I think, coordinate at a government level, right? Come up with a holistic plan for providing care in the home rather than some of the piecemeal legislation that we've seen.
Over the years that I've gotten a chance to know you, and certainly you, Bill, we've had a couple things come down from Washington. Affordable Care Act was one of the first, and the compliance that agencies and employers needed to have was quite onerous, and it was hard for us to really understand how to do that. And your firm was very pivotal in terms of helping us as agency owners figure out how to stay in compliance with that. And then, of course, during the pandemic, we had PPP, and how do we manage through that? ERC, how do we manage through that? And you've had to step out of your comfort zone, not just about labor, but really helping us agencies really be able to stay in compliance to those rules that come down from the federal government.
Yeah, what we see with home care agencies, oftentimes they're smaller and don't have the resources necessarily to keep track of what all the requirements are and what all the laws are. So during COVID, we really tried to step in and work collectively on behalf of a lot of organizations. Everybody contributed to the cause. We were able to work with clinical officers of different home care companies and home health companies to create some protocols to actually come up with a plan and a strategy for home care, which was different than what we were seeing from CDC, and some of the guidance that was provided to hospitals and long-term care, right? Home care didn't have a lot of that. So, and I think we really struggled as an industry during that time because of the unemployment that was provided to caregivers that was actually higher than what some people were paying their caregivers. That was really, really difficult. And I don't know that our industry has really recovered from that in finding enough caregivers to support the consumer.
Well, I can tell you it hasn't firsthand. And it's interesting. There are two things that have had a big effect on the workforce. One, and Bill, you know this very, very well, because I believe either you argued it or you were, there in the courtroom. And I'm talking about the companion exemption rule, and I'm talking about Koch versus Long Island Home Care, I think it was, and that was many, many years ago. We fought to keep that companion exemption rule in place, and I think it was 2014, it might have been 15, where that thing went bye-bye. And for the context for our listeners, and tell me if I get this right, Bill, the context was that this was a law that was passed back in 1974, I think it was.
Approximately so,
yeah. And that law was to enable consumers to be able to employ help for older adults as well as children and not have to pay overtime because they were having challenges financially to be able to do that.
Yeah, Congress had made a choice. In our view, it was the choice of the individual consumer of the services and their family members over the worker. Very difficult societal kind of a decision that was made. And we ended up at the U.S. Supreme Court arguing against the worker, but it really wasn't against the worker because so much of the service is either paid for by people on fixed incomes or coming from a government program, and we knew that neither one of those were in a position to cover overtime. The end outcome for the workers when it did it all ultimately did a 180 when the regulatory body changed the standard, the Department of Labor, was the worker didn't get anything benefited out of it, the consumer didn't get any benefit out of it, nobody got any benefit out of it because the system overall was not capable of handling an overtime compensation circumstance except in rare situations.
And that overtime, compensation base. I mean, I'm a Medicaid provider, so I mean, sometimes they give us authorizations for more than 40 hours. I can't work on the fee base that they're giving us. I can't work a worker in overtime because then it's a losing proposition for us.
In many cases, the worker still wants the compensation that they were getting overall, so they end up with 2, 3, 4 different jobs in order to piece it together, which creates a fire drill at people's homes when you keep changing caregivers or providers of services. So at the same time, and I know Angelo's certainly been there, and Bob, you as well too, treasure the workforce. The caregivers are special people.
Right.
They deserve good, solid compensation, but the system is in the way of that now, not you as an employer and not they as the caregiver themselves. So we've got to find a way to honor the caregiver as much as we honor the people getting the care.
100%. And you mentioned about the continuity of care. It's really important. I mean, consumers want to keep that down as low as possible because when a care recipient opens their door, they open their life to a caregiver, and the fewer people they can get in the door, the better. So, as I talked about 2015, 2014, and then certainly after the pandemic, I feel like we lost 20 to 30% of our workforce. They all went underground. Well, you're listening to Health Futures, Taking Stock in You. Believe it or not, we're at halftime here, guys. We're halfway through Health Futures. We got 2 more segments coming up. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. If you're just tuning in, we're in our second half here. I've got Bill Dombi, the president and CEO of the National Association of Home Care and Hospice, here in the studio with me, and I've got Angelo Spinola, attorney at law and shareholder and partner over at Polsinelli. And if you missed our first half, go up to our website at cypresshomecare.com. Click on the media button. Right below that is radio show. You'll catch this one and many, many more. So I want to pivot and really talk about the laws. And, that's the area of your expertise, Angelo. And there are a number of laws that we are dealing with, but, one of the challenges that we have is that, our agency is an employer-based agency, and many are, and there's a lot of benefits that come from an employer-based agency. Obviously, the background checks and the skill set checking and the continuity of care and the care oversight and the supervision, all of that comes from an employer-based agency, but there's also something called an independent contractor. And we see a lot of independent contractors in lots of different fields and areas of expertise. But in home care, we see that as well. And that becomes a little bit challenging in the sense that sometimes it's a sheep or a wolf in sheep's clothing. And, I think consumers don't really understand the differences. And some of these registries that engage these contractors, they look a lot like agencies, but they're not. And I would love for you to talk a little bit about that, Angelo.
Yeah, sure. The comment you made earlier about the reimbursement rates has a lot to do with this. And this is what I mean when I'm talking about a holistic remedy, right? We need to put all of this together because you've got reimbursement rates that often are not high enough to pay overtime. When you're talking about an independent contractor, they're not entitled to overtime. right? So you see the consumer in a private pay situation, and a lot of times the payor looking to independent contractor models in home care, of which there are many. There's the nurse registry you mentioned. There are virtual marketplaces like care.com where you can find caregivers, but they're not considered employees. And then you have another part of the government, the Department of Labor, that really doesn't like independent contracting, doesn't like the gig economy, and ordinarily will find those workers to be misclassified, that they're not truly independent contractors, they're really employees because they're being managed by somebody. That might be the consumer, because the consumer has hired them and is the one that's scheduling them and determining what they're going to be paid. Oftentimes, though, it's an organization. So you have this tug and pull, where you don't have enough money, being reimbursed to actually pay caregivers as W-2. So you now have these 1099 models that the government doesn't like, and it creates a real problem for the consumer, for those businesses. What we've seen, the laws just recently changed again, where the DOL just changed their test for determining whether somebody's an independent contractor. And so there's this constant swinging pendulum of trying to even understand what an independent contractor is and what model is inbounds and what's not inbound. So, and I think in general, those models, and I think this is the DOL's issue with them, it's very difficult, because if you're running a true independent contractor model and you really have contractors that are going into the home, that means you're not supervising those people or training them, right, and directing them, but they're going into the home of a very vulnerable part of our population. Mm-hmm. And so you see sometimes with these models that are being run like true independent contractor models, abuse. You can see that happen. So it's a really challenging situation. I don't think that there's going to be a solution anytime soon, because there is, the consumer-directed models that I believe are here to stay. I don't think they're going away, because it's necessary for at least some. I think Harvard did a study and said that when you're talking about private duty or where the consumer is paying for the care, only about 15% of our population can afford it. So there's going to be a model like that exists, but it has to change. It can't be the way that it is now.
I always look at the consumer-directed model, especially when it comes to care. I really think the disabled population, and I'm talking about the ones that are in chairs, that may have spinal cord injuries, and cognition is fully intact. I think they can direct a caregiver in terms of the way they want things. The thing that's scary for me as a provider of care is those that are suffering from dementia or Alzheimer's, and you get somebody who's an independent contractor that doesn't have the training, doesn't have the care oversight, doesn't have any of that stuff, then you've left someone extremely vulnerable at that person's hands.
Yeah.
You say that the government doesn't like it. What are they doing with it?
Yeah.
Are they doing anything to stop it, or?
Well, I find it really strange that you have one part of the government, and this might be at a state level, right, directing these kind of consumer-directed models, right, and looking for those models to fit within their reimbursement rates, and then another aspect of the government that's saying you can't do that, right? And these are, as you said, a wolf in sheep's clothing, right? The model you're running doesn't fit, and we would love to see those two arms of the government speaking with each other and coming up with a comprehensive solution. And then you also have, a sector of the government that's very focused on the rights of the caregiver. And as Bill mentioned, the caregivers are the key to the business, right? Mm. It's a special breed that does this kind of work. They don't do it to get rich, right? They do it because they have a lot of compassion and love for people. And so it is important that we focus on their benefits, their pay, but doing that in a vacuum without considering what the reimbursements look like, right, is going to make it impossible for agencies to really be able to effectively keep the cost of care down. And then you're going to have consumers that would like to be in their home and like to age in home, but aren't going to be able to do it.
You know, it's crazy because it all comes down to economics, right? I mean, the states are trying to do the most they can, and their budgets are really, really tight and small. And I'm talking specifically about Medicaid. And, you know, I don't know if I shared with both of you guys, but, you know, we took down a grant that was offered here in our state. Our state's Medicaid's called Access. It's the Arizona Healthcare Cost Containment System. And just by its very name tells you that they're trying to squeeze as much as they can out of every dollar that they get. And for us providers, the fees are so low. And the cost of labor has just gotten through the roof. And through this grant, they had some money left over from the American Rescue Plan, ARP, and they put out a demonstration grant, and we were the recipient of nearly $500,000. And what we're trying to do is bring value base. Because, Bill, you understand value-based because you guys have been doing that for many years in the Medicare world. But in Medicaid, it's still stuck in the old paradigm of fee-for-service. And we've got to be able to show that we belong here, we can improve outcomes, we can keep people where they want to be. And in this grant, I like to say it's a collaboration between two other companies. One is an online training platform called Navan, and the other one is a telehealth platform called Pocket RN. And we're giving those family caregivers those tools to be able to keep people at home. And we're trying to demonstrate to Medicaid that we're bringing value, and I hope we can get some shared savings so we can get some more dollars.
I mean, when looking at the aspect of value, you know, too many of these programs are stuck in an anachronistic kind of mindset where they're looking at a discount on the service, putting it in a bit of a silo rather than seeing it as a holistic service that has a dynamic impact overall. And whether it's personal care supports or nursing services, the combination of all of that, it adds up to a value when it's well coordinated, when shifts of care are actually met, when the supports are there from the financing side of things to actually get the job done right. And when you're looking at Medicaid programs, though, you have a tension. It's either number one or number two in a state's budget when it comes down to it, education or Medicaid,
right.
Medicaid or education. And that may be a very difficult thing for politicians or agencies, administrative agencies, to run, but they would be in a much better place if they started seeing that holistic value and seeing how doing X ends up a benefit of A, B, C, D, and the rest of the alphabet.
In our state, the teachers can go down to the Capitol and they can march and they can be there, and numbers as large as tens of thousands of people. Our home care aides, they can't leave their loved ones to do that. So, I mean, they're the kind of the silent group out there that really needs help.
And likewise, the people they're caring for, they're bedbound. They're not going down to the Capitol.
100%. Well, you hear a little bit of The Who taking us out. Mm-hmm. Bill, I ordered this one just for you.
One of my favorite bands of all time.
There you go. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We're down 3 segments, and we got one more to go. I've got Bill Dombi and Angelo Spinola here in the studio. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you are just tuning in, we're in our last segment. I've got Bill Dombi, President and CEO from the National Association of Home Care and Hospice here in the studio, and I've got Angelo Spinola, attorney at law, partner and shareholder at Pulcinelli. If you missed the first 3 segments, go up to our website at cypresshomecare.com, click on the media button. Right below that is radio show, and you'll catch this one and many more. So we've talked about a lot of different things. We've talked about healthcare. We talked about home care. We've talked about the labor laws. We've talked about the challenges we've had for, paying for these services. We've talked about the challenges we've had in terms of finding workforce. I think what I would love to end in this last segment is really talk about the future. Where are we going? It's hard to believe we're in 2024, Bill. I mean, I've known you for at least 20 years, and I've gotten a chance to know you, Angelo, for probably at least a half a dozen years or so, and a lot has changed just in those years, especially in the last 5 or 6 years with the pandemic. Bill, I'm going to look to you first. Where do you see home health, hospice, home care? Where do you see that going 24 and further?
Well, the first thing I think about when we look towards the future is the role technology will play in home care services. And it's already a significant role, but we're seeing a greater degree of consumer-directed healthcare supports, technologically wise, in the home setting, teaming up then with the great technologies that home care providers are able to bring to control quality. The caregivers are connected instantaneously to physicians' offices and to their home office. When something arises within the home, they're capable of meeting that individual's needs. There's remote patient monitoring of people 24/7, where they know when the condition is going a bit south, so there could be an intervention along the way. There are virtual visits happening, not with just physicians, but nurses and therapists, training family members in self-care. So everything is directed towards improving the opportunities for healthcare at home and to bring efficiencies as well, to take advantage of the technologies to supplement that workforce, which remains less than what we need out there in a workforce. So I see the opportunities for healthcare services at home growing exponentially over the coming years. The demographics demand that we have the kind of support structure of technology combined with in-person services, because there are more of us growing old than there are growing into the workforce to provide care to those individuals. I reference myself as an example there, that when my parents were aging, they had 4 children to help provide some caregiving. I have 2, so I have half the workforce capable of meeting my needs, plus the fact that I've alienated probably both of my kids. They don't want to spend any time caring for me.
Well, I remember you doing a presentation a few years back, and you threw up a little clip of a video. I think it was called Frank and the Robot. You see robots coming?
I am a science fiction fan from way on back. And when I learned that scientists at MIT and scientists in Japan and scientists at the largest technological brain trusts that exist in the country are working on developing robotic healthcare services, I believe it will be there. At what point in time, I don't know. I also have a fantasy. I'm a fan of the Terminator movies, but I would hope that in the real world that they don't become warriors and killers. Instead, they become caregivers, perhaps.
I love that.
But no, I fully believe in that. When you look at what you see out there in self-driving cars today, and you see, putting French fries in little cardboard containers at fast food restaurants and everything else in between, the technology is going to give us those opportunities.
And you see in those cities those little buggies that look like ice coolers that are going down with the flags. I don't know if you've seen that in Washington, D.C. or New York. It is pretty fascinating. And there are crosswalks and somebody, the artificial intelligence is operating. You have to see that.
AI is scaring a lot of people. The reality is we're in a position to have it be our best friend.
I couldn't agree with you more. So, Angelo, talk about the future. Where do you see things with, the workforce? Because that's the biggest challenge that we have.
Yeah. I think that's the biggest challenge. I am overall bullish on where we're going as an industry. I think that COVID and that experience really, I don't want to say put home care on the map, because it's always been on the map, but it really emphasized the value and the importance of care at home. When you had COVID spreading in the facilities, people not being able to stay safe and wanting and really needing to be at home. And we've talked about it today. It's the least expensive way to care for somebody. It's the most popular way. It's what we want as consumers, as we want to be in our own home and age in our own home. So we're going to have to find a way to make it more affordable and more holistic, right? So I think that we will see, right now at a state level, there's a real hodgepodge of regulations, of reimbursements. I'd like to see that get a little more standardized, a little more predictable. The workforce is going to be a real challenge. That's going to be a real challenge, is where are we going to find our caregivers? And as much as I love robots and the Terminator and all of those things, there's a human element to this business, a local human element that I don't think will ever be replaced. And technology is important, and we're seeing our clients use it all the time. AI is being adopted for things like scheduling and optimization and those type of things. But at the end of the day, it's going to be a human being that's providing this care, and we need to find those unicorns, a lot more of them, to be able to handle the population that you're talking about. And that might be an immigration fix where we're bringing people in from other countries. There's some ways to do it. There's partnering with schools, but we right now see caregivers leaving this industry to go do other things in other industries where the barrier of entry isn't so hard and maybe the work isn't so challenging.
Now, you brought up the word immigration, and I think it's a great way to maybe end. It's kind of viewed as a dirty word right now just because of what's going on, especially you guys are visiting Arizona, what's going on at our borders. But, Bill, I look to you, immigration, how do we get more visas from caring nations? And I can name about a half a dozen that would love to have people over here or send their people over. How do we do this?
I wish I had an answer, and I wish the 435 members of Congress also had an answer, along with the White House, on that. I mean, this is one of the most politically hot-button issues that we are facing in the country. I come from a generation where my grandparents were all immigrants through Ellis Island, and I saw what they did to build the opportunities that I ultimately had. If we can have that revolution again in thinking, I believe we could find a way to do it right. But it is extraordinarily complicated. But we need the people to be the caregivers, to do the high-touch part, to join in with the high-tech part of healthcare service.
I think there's no better way to end our show. Guys, Bill Dombi, Angelo Spinola, I can't thank you enough for joining me here on Health Futures today. Make it a great day. Have a great weekend. We'll be back next Friday.
Thank you.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.